was just a wonderful group of talks that we had here. Hopefully Dr. Sabo is still here. It was, I think, really impactful. Hi, Mary. We will open it up right now. We will respect your time as well, but we do want to give an option or give a chance for people to ask some questions. Allison will moderate this, and then I think she'll turn it over to Samantha at the end. But please, Allison, take it away.
All right, so Dr. Szabo, this one came up. Somebody said, I've been surprised at perhaps the unintentional shaming and blaming from friends and family who comment on why they think you have melanoma. Oh, that's because you went to Hawaii. How can a patient deal with this pervasive feeling of shame that he or she has cancer?
That's a great question. One of the ways that I encourage our patients to address that is to really bring that shame into light, right? I mean, shame is a really intense, painful feeling, right? It separates you from other people. It makes you feel like you're flawed or wrong or unworthy, or in light of melanoma, worthy of having cancer because you caused it. So we try not to talk about it because we don't want to deal with it, but that's not the best approach. The less you talk about the shame that you're getting and not put it on the forefront, it has more power over your life, right? So getting beyond it really means acknowledging it and sharing your experience with someone you trust, right? And who knows we aren't perfect. And that empathy over time will help with our sense of shame and also help to give you some resilience in dealing with it as you move forward. I always think of it like if you acknowledge that shame, you refuse to let it fester or define you. But when you bury the story, you always are going to be the subject of the story. But if you own the story, you absolutely get to narrate the ending. So try to untangle what you're feeling, really identify what is the emotion you're feeling, and then unhitch what you do from what you are and who you are. So you are a sun worshiper, so you are a cancer patient. Unhitch that. Don't make it a part of your identity, whether it's the behavior or the cancer itself. And then recognize your triggers, right? I mean, you're gonna know those individuals who trigger you sometimes, and then sometimes maybe not. But know those triggers so you can learn to identify more before you're taken off guard. But also, making connections. Shame is the essence of fear, right? And disconnection. So when you're feeling that shame, somebody's separating you from he or she. I don't have melanoma and I wore sunscreen, or I wasn't a sun worshiper. And you're a person who has melanoma and you were. So don't allow that to disconnect. Make the connection. And I hope that kind of helps. It's not easy and it's not comfortable, but it's where you take back power, and that will empower you in your relationships.
Fantastic. Thank you for such a great answer, Dr. Szabo. Now, Mary, this question is back to you. What do you mean by if your headlights are off, you need to reapply sunscreen?
So what I mean by that is that because your headlights are off, there is sunlight out. We don't typically have our headlights on when there's sunlight out unless you have set your car that way. But that's why I say when the headlights are off, it's because there's sunlight out. So you should be applying and reapplying your sunscreen every 2 hours.
Fantastic. Thank you. I appreciate that. So the next question I'm actually going to answer, is there a difference in protection between mineral and chemical sunscreens? So first of all, chemical sunscreens they absorb the UV rays, turn them into heat, and then they're dissipated through your body. And mineral sunscreens are actually physical sunscreens, and they sit on the surface of your skin and reflect those UV rays. So, a lot of people ask why we would use physical versus chemical sunscreens? And the answer to that is really physical sunscreens are great for people with sensitive skins, or if you're concerned about the ingredients in your sunscreen, and also for children. However, the caveat to this is any sunscreen that you're comfortable with wearing is better than no sunscreen. Okay. The other question is there a risk of during daylight if the UV is 0? UV is 0 only at nighttime, and you can actually get a sunburn on a cloudy day. So you should be using sunscreen absolutely every day that you go outside. Okay. Next one, Dr. Gimbel, could a shave biopsy spread the melanoma?
I tried to answer some of these in the questions offline, but can it spread melanoma? It's a hard question to answer. I've never seen that someone who gets a biopsy for melanoma that they now have disseminated or widespread disease. We need the biopsy to know how to treat you. And to be honest with you, most of the biopsies that are done aren't melanoma. Melanoma is more of the rare diagnosis from a lot of the pigmented lesions that are biopsied. The vast majority aren't melanoma. So we're not going to put patients through significant treatments if we don't even know that it is melanoma. Plus, the treatment that we offer is dependent on the depth of the tumor. And if you recall the surgery that I perform, once we have the diagnosis of melanoma, I then go widely around that to get normal tissue in case there are any other cells that might be present. But I've not seen early melanomas that get a shave biopsy. And even if there is a delay to surgery for a couple months, that it spread. We actually, during COVID, had to decide which patients needed to be taken to the operating room more urgently than others. And we actually stated that thinner melanomas that were biopsied could be delayed up to 6 months, if need be, for their surgery, because we just didn't feel that there was a risk.
Okay, great. Thank you. Now, Dr. Mahmood, this has come up with multiple people. What are some of the side effects of immunotherapy and how can I manage them?
So the side effects of immunotherapy, I mentioned, like, for example, skin rash. People can have itching without skin rash without itching. The other side effect is immune-mediated colitis, meaning diarrhea. And when diarrhea, it happens, we try to educate the patient, call us, please, especially if you're having more than 3 episodes of diarrhea a day, lose a stool. This is not something you ate. It's not a poison. It's not treated with antibiotics. This needs to be managed with prednisone. And failure to manage these patients with the prednisone may result in perforation of the bowel. Although it's a rare side effect, this complication, but it's a very significant one, and we don't want to lose our patients to this side effect. We give them prednisone and we taper it over 6 weeks. Sometimes prednisone doesn't work for some of our patients, so we have to give infliximab as a rescue. Other side effects, the endocrine side effects, meaning hypothyroidism, hypophysitis, the pituitary gland in the brain will not work, and also diabetes. Diabetes is very, very rarely. The endocrine side effects are not reversible. They are treatable, but the function of the gland will not come back. And that's something we tell our patient and educate them. Other side effects, inflammation of the liver, inflammation of the kidney, they are all rare side effects, but these are some of the side effects of immunotherapy.
And great, thank you so much, Dr. Mahmood. Dr. Gimbel, this question keeps popping up. Should a person avoid shaving when there are face sores or moles that look maybe at risk for melanoma? I've seen this one pop up like 4 or 5 times.
So let me see if I understand the question correctly, that if there is a spot on the face, will shaving turn that into melanoma, or would it
cause it to spread if it is a melanoma or something like that?
You know, I have to go back to say, if you think it's melanoma or suspicious, get it biopsied. If you have a lesion that you're shaving over, I have lots of freckles for growing up in Arizona before I knew anything about the sun being a bad thing, and it doesn't impact when I shave. Your skin, you're not technically shaving off your skin when you shave, you're shaving off the hairs, although you can nick yourself. But again, if you have a spot that's concerning, get it biopsied so you don't have to worry about whether or not you should shave or not.
Okay, fantastic. And Jennifer, how often are new cancer-related genes discovered? I have 3 of my siblings have a germline BAP1 mutation, which I understand was discovered relatively recently.
Yeah, BAP1's a really fascinating gene, and it's one of the newer ones for melanoma. So I will say that we are discovering new genes all the time for something like hereditary melanoma that's not genetically as well studied as like hereditary breast cancer, hereditary ovarian cancer. We're definitely discovering more genes, and we're discovering ties to melanoma with other existing genes. So it might be a gene that's been well studied for a long time, but we just haven't linked it to melanoma yet. The more we do panels, so like testing patients for a wider array of genes, the more we're finding incidental findings, the more things we're learning about. So if you ever had any genetic testing that came back normal, and it was like a small panel or it was done, we usually say prior to like 2015, it's usually worth looking to see if that needs to get rerun on some of the newer genes that have been discovered. And then we usually say that it's not a bad idea to recontact a genetics provider every 2 years just to kind of see, have there been any updates in the field of genetics? Because there are still thousands of genes that we don't even know what they do yet. Could one of them be a cancer gene? It's totally possible, unlikely, but it's definitely possible. So it's always good to kind of keep up to date on it. And then we also are learning new things about genes too. So like BAP1 being a really new gene, we're learning about new cancer risks for it and stuff like that. So also a good thing to, if you're hooked up with a genetics provider, they should be able to give you updates on any new like genes or recommendations or things like that tied to a gene.
Fantastic, thank you. So the last question is actually for Lynn or Sandy. How do I get referred to a survivorship program?
Are they a patient at MD Anderson?
Just in general.
In general. Okay, so it can come from any outside primary care provider or any on-call, any like physician assistant, nurse practitioner, physician within the cancer center. So I would just say ask for an order from your provider.
Fantastic. Thank you, everybody. I think we should answer the rest of the questions directly in the sake of time and turn it back over to Samantha.